now to present healthcare policy, diagnosing the problem. Please welcome Dr. Astorino.
Pretty good.
Well, thank you, Richard, and welcome. I want to thank you all for being here today. At some level, I believe you all realize that this is truly an issue of life and death. And unfortunately, our politicians, I believe, are taking us on the path not to life. Now, most people believe that there are so many problems with healthcare finance that it's impossible to solve them all. This is true if you believe that you have to solve every perceived problem. I will show you, though, that most of the problems are simply symptoms. I hope to convince you that there's a single cause for all these symptoms. That is, I will approach this like a doctor approaches a patient. To make this analogy clear, let's consider a patient presenting to a doctor with several symptoms. Say, a red eye, pain, fever, night sweats, cough, chills, weight loss, fatigue. Now, a doctor doesn't approach this like 8 problems to solve. He recognizes these as symptoms, and he looks to discover the single cause. In this case, further examination would reveal this patient is suffering from tuberculosis. And curing that condition with the appropriate antibiotics relieves all the symptoms. If we take this same approach to the symptoms of healthcare finance, we can make a proper diagnosis and effect a proper cure. Now, what are some of the prominent symptoms that we hear about in medicine? It's too expensive, there's too many uninsured, people have pre-existing conditions and they can't get their health insurance, many people are uninsured when they change jobs, billing and paperwork are nightmares, etc., etc., etc. The first thing a doctor would do is to take a history. The first question that would come to mind would be, why do we get our health care from our employer? When did that start? Has it always been the case? Well, our history must take us back to around 1940. FDR instituted a wage and price freeze, fearing that the loss of workers for the war effort would result in a raise in wages and prices as employers tried to attract the dwindling workforce. Consequently, employers tried to attract workers with health benefits. By 1942, the IRS caught up with this and was going to tax the health benefit. By 1943, the IRS granted a tax exemption for employer-owned health insurance after political pressures were applied to Congress by the unions. Today, that exemption means it is free from FICA, state, and federal income tax, which amounts to about 25% to a 60% reduction in the cost of your insurance when your employer buys it for you. What does this ruling say in principle? If you're personally responsible for owning and purchasing your own health insurance, you have to pay a lot more. If you can get your employer to pay for it, it's a better deal. This policy fundamentally discourages personal responsibility in the realm of medical care. Did the market respond to this incentive? Yes. In 1940, only 9% of people had hospital benefit plans. By 1950, over 50% did. And today, over 95% of health insurance policies are owned by the employer. Consequently, they're not portable. This creates the uninsured issue when people change jobs. It also leads to job lock, where people feel trapped in their job because they may lose their health insurance if they change and they have a pre-existing condition. And then those with the pre-existing conditions, when they do leave their job, are unable to get private health insurance. None of this would happen if the insurance was personally owned. So, is discouraging personal responsibility by government policy a good idea or a bad idea? I submit that it's a bad idea, and it has resulted in these and many other destructive consequences. Now, is there a deeper issue underlying this? To help you consider this, I would like to quote our first president. Government is not reason. It is not eloquence. Government is force. Like fire, it's a dangerous servant and a fearful master. George Washington, 1797. Here, Washington recognizes that fire as our servant heats our homes, cooks our food, and enhances our lives. And government as our servant should protect our rights and our property. However, like fire, when out of control, it will destroy the things we value. FDR utilized the force of government to dictate the wages that private employers will offer private citizens. What right did he have to do this? Congress forced you to have your employer own your insurance policy in order for you to get a tax break, and penalize any of those who purchase their own insurance. No other particular fact that you discover about healthcare finance will alter this fact. When you recognize this principle, the inappropriate use of government force discouraging personal responsibility, you will begin to see it everywhere. Any reform idea that does not recognize this and address it will not cure the problems that have resulted from it. What are some of the other consequences of this employer-based health insurance? Most people want to use their medical insurance for almost all medical interactions. Compare this to your auto insurance policy or your homeowner's insurance or even your life insurance. Are you dying to use your life insurance today? No. Real insurance covers catastrophic, unexpected events, protecting you from financial hardship. Why is that not the case in medical insurance? Well, once health insurance was provided by the employers, unions eventually bargained for 100% coverage. The concept of medical insurance became equated with comprehensive medical care. One consequence of this was that actually insurance companies became villains when they denied coverage for valid reasons, like pre-existing conditions, because it was viewed as if they were wrongfully denying people care. Too many people today believe it's okay to use government force against insurance companies to cover everyone regardless of risk or the certainty of needing medical care. These are referred to as guaranteed issue laws. Now, to understand this, let's consider insurance in another realm, homeowners insurance. Currently, you're able to deduct your interest on your home mortgage. But for purposes of this hypothetical example, let's assume that this deduction is only possible if your employer purchases your homeowner's policy for you. Consequently, almost everyone has employer-based homeowners insurance. Your house catches fire. You're between jobs and have no homeowner's policy. You immediately call an insurance company to get coverage. Your request is denied. You believe this is not your fault, and you and others complain to Congress. Eventually, a law is passed that requires all homeowners policies to guarantee coverage of fire losses after the fire has started. Now, this is just like the guaranteed issue law that exists today in medicine. More people choose to go uninsured until their homes are burning. Rates skyrocket to cover the cost of all the uninsured homes. Government force establishes a mandatory rate cap on insurance companies. Government force mandates everyone to own homeowners insurance and establishes fines and imprisonment for non-participants. More government agencies and policies are established to enforce these new regulations and mandates. Government force is being used everywhere to try and fix the consequences of its first mistake, discouraging individual ownership of the insurance policy. This is precisely what's happened to medicine today. In medicine, how do our politicians propose to cure the symptom resulting from employer-based insurance? They vilify employers that don't offer insurance and propose to force them to offer it. They see insurance companies pricing risk by sound actuarial methods and then ask them to apply unreasonable standards such as guaranteed issue. They blame the uninsured for not contributing their fair share to the insurance pool. They propose to force all individuals to own insurance with consequences of penalties and fines. All the proposed solutions only offer more government force. All these ignore the cause dating back to 1942. Before producing more mandates, fines, penalties, government should first offer the same tax exclusion to every individual. And that's our first step for healthcare reform in the private sector.